Hello, we are the Skittles. We are a team that comes together to help improve collaborative interprofessional team functioning. We specialize in quality care with chronic disease management with discharge planning.
Today, this is what we'll be focusing on during the presentation, and afterwards we'll have a question and answer period.
Our mission is to empower each of your team members to develop innovative and creative leaders. We will strive to teach your members how to treat each other with respect and fairness and to be culturally aware so as to achieve the goals set out by the team.
As the name suggests, we're a diversified team that works well together, and we will share our tools and strategies to help your center effectively collaborate with regards to chronic disease management and discharge. This is our team, and each individual is specialized in their own areas that helps lead our team to a successful goal.
We would like to thank you for the invitation to address the situation that is occurring at the Manchester Health Centre. The Skittles project is aimed to improve Manchester Health Centre chronic disease management in regards to discharge planning, with a focus put on a collaborative leadership. We would like to introduce you to a situation occurring at a health centre similar to yours.
Nurse. Just a minute, Mr. Kirby, I'll be with you.
No problem. That's fine. Yes, we'll try our best. Yes, we can do that. We'll try to do that. Okay, thank you. Bye. Bed manager, he wants us to clear 3 spaces today.
It's never ending. Let's see what we can do. We can try chasing the referral from Mr. Kirby at the community hospital. Where are his notes?
Well, Dr. Ahmed's already got him medically stable and signed off.
So he should be the next one to move on.
Yes, but has he had his assessment yet?
They were all away at that conference last week. I think he'll have slipped through the net.
Well, I'd get in there as quickly as possible before anyone else picks it up.
I'll phone them.
Is it all right if I go for my break now?
You wouldn't get that buzzer on your way off, would you?
Who is it?
Guess.
Oh no, not Mr. Kirby. Yes, Mr. Kirby, what can I do for you?
The slipper's come off my foot again. Can you put it back on?
Is that all you wanted me for?
Just before you go, can you get me a glass of water? I don't know where my tea went. I think they missed me out.
This was your tea. Look at the mess of it all.
Hello, Jennings Ward.
Hello, it's Staff Nurse Biggs here, Ward 9 at the acute hospital. Could I speak to the nurse in charge, please?
Sister's at a meeting till 12. Can I help you?
Yes, I'm sure you can. I'm calling about Mr. Kirby, who we've referred to you. Do you need any more information before you accept him?
Let me just get his referral notes. Right, I could do with just checking a few details, please. The past medical history I have that Mr. Kirby is a 72-year-old gentleman with type 2 diabetes. He has an old stroke resulting in left side weakness. He had a fall a couple of months ago and fractured his humerus, and that was repaired. Then following some rehab, he was discharged home about 2 weeks ago.
Yep.
He's not coped well at home and was readmitted last Tuesday with heart failure.
Yeah, that all sounds right.
Okay, so can you confirm you're referring Mr. Kirby to us for rehab, focusing on improving his mobility and discharging him home?
Yes, that's right. He needs his mobility improving and he definitely needs discharging.
Okay, can I just ask a few questions about how Mr. Kirby's been getting on with you?
Okay.
What's his mobility like at the moment?
Well, let me have a look. He's just in front of me now. Well, he's sitting out in a chair at the moment, and he has a Zimmer frame, and we usually only give those to patients who are mobilising with supervision. His degree of self-care is fine. He usually manages to wash the top half himself. And he gets by with a bit of help now and again.
And what about eating and drinking?
Eating and drinking? Oh, definitely no problems there. He really enjoys his food.
Okay, and what's the family situation like?
Well, Mr. Kirby was recently bereaved. His wife died a few months ago, so he actually lives alone now. He has a son who's keen to offer extra help when his dad gets discharged. And he only works down the road from where his father lives, so he's really close by to help out if any problems cropped up.
Okay, good, that's fine. So all in all, would you say Mr. Kirby's a good candidate for our 6-week rehab programme? He sounds really keen and motivated.
Oh, definitely. He really wants to get home.
In the video, it shows how the management called down to say that they needed to discharge 3 people by the end of the day. The staff looked at Mr. Kirby and thought that he would be a good candidate because he was call bell happy. If the staff had done a proper assessment on Mr. Kirby, they would have noticed that he was not a good candidate for rehab. He was not mobile and was having difficulty with the management of activities of daily living. The video shows the lack of collaboration between the team members. That also has an impact on patient-centered care.
SKITTLES aims to achieve these goals within a year of us being at the Manchester Health Centre. We will define the roles and responsibilities of all members, strengthen interprofessional team functioning, and refocus staff as to Manchester Health Centre's vision, mission, and values.
This graph illustrates the current performance levels of the center. The second graph shows the current performance values compared to targeted performance levels. The readmission rate will be reduced by 20%. We will increase bed availability by 10%, and staff turnover rate will be reduced by 40%. These improvements will have a positive impact on patient and staff satisfaction and overall company morale.
By choosing SKITTLES to implement change at your center, you will have a positive impact on patient and family members. You will increase productivity and quality of care, and this will lead to a reduction in readmission and bed blocking, which in turn will save the center money. By creating a team that is able to communicate with each other openly about patient care, this will increase patient satisfaction and reduce the length of hospital stay on the average patient. In the next slide, you will see the impact of open communication and collaboration within the interprofessional healthcare team members.
Hi, Mrs. Jones. Could you please tell me about your living arrangements and if you have any bathroom aids?
Like I told the doc yesterday, or whoever he was in the white coat.
You mean the nurse practitioner?
I don't know who, but I told him and another woman in a blue blouse, as well as my nurse this morning, don't you people talk to one another? I'm supposed to be getting rest, and instead one of you people comes and wakes me up every half an hour to ask the same questions.
These frustrations could be minimized by increasing collaboration amongst the healthcare team. For example,
Okay, let's get started on today's rounds. Looks like a busy day. Mrs. Jones lives at home alone, has home care services coming in twice a day. Up until 3 days ago, she's getting around on her own. How has her mobility been from everybody's standpoint?
Well, I've been helping her shower, and she's a bit wobbly.
We popped in the other day and she said she was too tired to walk. She says she hasn't had any falls before. She just came in because she felt weak. But that's explainable by her pneumonia.
We can fit her for a bath chair or some guide rails.
Good idea.
Hi, Mrs. Jones. My name is Jessica, and I'm your occupational therapist. The team was discussing your care, and it sounds like you're eager to get back home. The doctor says the pneumonia is clearing up nicely, and the nurse says you're feeling stronger. Let's talk about how you get in and out of the bath at home. Do you have any equipment to help you?
I prefer to take a shower, but I'm not sure that I can stand for that long.
We could fit you for a bath chair that you could use.
That sounds great. What do we do?
Well, we would go with
At the beginning of the video, you see the patient being frustrated with the constant interruptions from the team members. In the second half of the video, you should have noticed that the team works effectively together and involves the patient in their care. This in turn has a positive impact on the collaborative team and patient satisfaction. This would lead to the patient being discharged faster, reducing the length of stay in the hospital.
So, you're probably wondering, how are we going to achieve these goals? Well, the first thing we will do is an assessment of the current situation at the center. Our next step is our planning. We will include training programs and role clarification. We will start opening the lines of communication between our team members, and we will connect with the community resources. The next phase in our plan is the implementation, and in this area we will focus on staff training and education. The development and introduction of the follow-up telephone protocol to be given to the patient after they have been discharged. This will help answer patient questions and concerns and assist the continuity of care.
We plan on finishing these goals by these target dates. We will evaluate the changes made within 6 months of the introduction. For final evaluation, which will include lab results and patient feedback, readmission rates, bed availability, level of employee morale, staff turnover rates, interprofessional team functioning, and an increase in the readiness for discharge will all be conducted within 10 months of the introduction of the SKITTLES project. We plan to have this project wrapped up within a year.
These are the jobs that SKITTLES team will be able to do. We will implement tools for chronic disease management and discharge that will be patient-centered. We will improve the collaboration between multidisciplinary professionals. We will develop and implement telephone follow-up protocols. And lastly, to boost company morale, we will organize retreats that remind employees of the Manchester vision, mission, and values.
The SKITTLES team will not be able to perform the following: hiring and firing of staff members, implementation of the electronic health record, placements for long-term care and alternate level of care, and future transportation for follow-up appointments. We'd like to take the time to thank you for this opportunity to present our charter concerning the necessary changes to make Manchester Health Centre an innovative place for all staff members to work and to patients to receive a higher quality level of care.
If you have any questions, feel free to ask now, or if you have any future questions, feel free to contact our manager, Shauna Ridgewood, at 905-721-3166.